Tonight, we'll look at a daring monster that is rearing its head, Lassa fever. Nigeria is once again confronting the threat of this disease, a viral hemorrhagic ailment that continues to test the country's public health system, emergency preparedness and community awareness. What is worrisome are the new cases being recorded, with scores of lives lost and confirmed cases rising across multiple states. Now, the Nigerian Center for Disease Control and Prevention has reported an increase in confirmed Lassa fever cases in some states across the country. Health authorities describe the situation as alarming, particularly as the virus spreads among frontline medical personnel. In response to the outbreak, the NCDC said it has activated a national Lassa fever multi-partner, multi-sectoral incident management system to coordinate response activities at all levels to contain the outbreak. Despite ongoing interventions, the NCDC has identified several challenges, including late presentation, which is contributing to the rise in case fatality rate, limited public health campaigns and community sensitization. On Weekend File, we x-ray Lassa fever, counting the cost, confronting the crisis, and our guest is Dr. Yetunde Abuja. She's the National Incident Manager for Lassa fever and lead of the One Health Coordination Unit at the Nigerian Center for Disease Control and Prevention. In the meantime, thank you for joining us. I'm Ruth Aguele. Now, before we delve into the issues, let's bring you developments across the country. The federal government says it is systematically investing in an ecosystem where digital technology will be harnessed as a ladder to attaining positive opportunities in Nigeria. The Minister of Information and National Orientation, Mohammed Idris, at the 2026 Joint Annual Ramadan Lecture organized by NTA, FRCN and VAN, emphasized that media literacy remains an effective vaccine against misinformation. Salihu Abdullahi Gwanara reports.
For 2 decades now, this has remained a veritable platform for intellectual and spiritual dialogue that is promoting brotherhood through topical issues towards nation building. The government spokesman joined other stakeholders at this year's lecture titled Digital Technology and the Moral Future of the Youth, and updated Nigerians about lifetime government projects on youth empowerment as a critical pillar of the renewed hope.
The 3 million technical talent, 3 MTT program, that is a pipeline for connecting trained youth to real economic opportunity. The Nigerian Education Loan Fund, NEL Fund for short, removes barriers to higher education by ensuring that no Nigerian young man or woman is turned away from school due to family circumstances. The Presidential CNG initiative creates thousands of jobs for young mechanics and entrepreneurs, demonstrating how technology unlocks opportunity even in traditional sectors. The renewed hub infrastructure projects, from the coastal highway to the Sokoto-Badagry Expressway, provides immediate employment for youth in construction and engineering.
He reaffirmed that government cherished the population of Nigerian youth and reminded them of some basic moral obligations.
The phone in your pocket can be a distraction or a sustenance depending on your own choice. Seek knowledge with sincerity, knowledge that draws you closer to Allah and equips you to serve. Verify before you amplify. Use your digital presence to build, model civility, and demonstrate that faith and patriotism are complements. Remember your dual identity. You are citizens of a great nation and members of a global ummah.
This forum got the commitment of policymakers for sustainability as part of efforts to impact knowledge towards building a greater and morally standard nation. From Kaduna, Salihu Abdullahi Gwanara, NTA News.
Despite its advantages of quick dissemination of information, digital media must be used responsibly to promote unity and contribute to the progress of Nigeria. A renowned communications scholar, Professor Umar Pate, stated this during the 20th annual Ramadan lecture. Let's see that.
Social media has become an integral part of people's lives. Invited guests here arriving for a lecture that focused on the influence of social media platforms. It is the 20th annual Ramadan lecture organized by NTA FRC and Amvon, where the guest lecturer, Professor Umar Pate, examined the impact of digital platforms in the society.
Digital technology. Digital technologies navigating us towards progress is also giving us a number of issues that of necessity we must worry.
We live in an era defined by unprecedented technological advancement, where the digital world has become an indispensable part of our daily lives.
We are committed to delivering credible, accurate and timely information, promoting national unity, and upholding the highest standards of professionalism in public broadcasting.
The stakeholders, including traditional rulers, called for collective action to ensure digital platforms are used positively.
From an Islamic perspective, technology is a tool that must be harnessed for the greater good.
This is a very commendable effort, by NTA assembling all of us here almost every year.
It may therefore be high time to start considering proper monitoring for social media. Even in the so-called developed nations and democracies, there are policies in place aimed at protecting the youth from the adverse effect of social media.
They agreed that this conversation must be extended beyond this forum to find a lasting solution.
There are positive aspects of digital education, technology in the media space, so we need to just encourage those positive aspects.
Technology is neither a devil or is not an angel, is not an adversary. It's a tool. It's up to you, to decide how to use it.
The participants expressed optimism that the messages shared here will contribute in reducing the negative impacts of social media in the society. In Kaduna, I am Muhammad Umrajingi, NTA News.
From the global scene, nations worldwide have expressed grave concern over a potential full-scale Middle East war following joint United States and Israeli military strikes on Iran this Saturday. The attacks prompted swift Iranian retaliation, including missile barrages targeting U.S. military bases across the region. Musa Baba Aliyu reports.
February 28, 2026 will be boldly written in global history as the date of the joint Israel-US military strike against Iran. The war has since escalated beyond Iran's border, spreading to its neighbors. As explosions continued to reverberate across multiple countries and air defenses intercepted incoming threats, the international community watched anxiously for signs of further escalation. Russia sharply criticized the US and Israeli action, stating that they were pushing the region towards a humanitarian, economic, and this cannot be ruled out radiological catastrophe. The African Union appealed for restraints, urged the escalation and dialogue, warning that prolonged conflict could adversely affect stability and populations on the African continent. Musa Baba Aliyu, NTA News.
And following that development, the federal government of Nigeria is concerned over the escalating tensions in the Gulf region, calling for maximum restraint and dialogue to prevent further unrest. A statement from the Ministry of Foreign Affairs emphasizes respect for sovereignty, territorial integrity and international law, urging parties to prioritize peaceful resolution. Nigeria advocates for restraint in using lethal force to protect civilians and adhere to UN Charter and Geneva Convention. The Nigerian government further expressed its solidarity with the international community, seeking sustainable peace through diplomacy and mutual respect. We turn our attention to legislative matters. The Senate Committee on Information and National Orientation says there is an urgent need for improved budgetary allocation to the information sector to enable agencies discharge functions of information dissemination to achieve value reorientation as well as harmonious and united Nigeria. While submitting the budget defense report on the sector before the Appropriations Committee for consideration, the Chairman Senate Committee on Information, Kenneth Eze, noted that the 88.9 billion naira 2026 allocation to the ministry and its 9 agencies is inadequate and appealed for more.
Last year, we drew the attention of this humble and honorable appropriation to the meager sum of money that was allocated to a whole information sector. So this year, I further appeal to this very reverend committee to further look into it. Information is a very sensitive sector, well funded. They will give this country what they need, especially in the area of orientation.
There's so much of interference, yes, with their operations, okay? I want to believe that some of the coverages, okay, by NTA, payments are not being made. They are not paid. They should be able to pay. Okay, let NTA operate as a purely commercial venture.
Agencies under his committee play a very vital role in value orientation, instilling discipline and patriotism to citizens, and they are equally custodian of government policies and programs.
Also making submission before the Appropriations Committee, the Chairman Senate Committee on FEMA, Sahabi Yao, solicited for more funding to the Agency for Rehabilitation of Road Network.
Of this administration, in expanding the quality of infrastructure, it is expedient for the federal government to appropriate more funds to ensure thorough assessment of road conditions, which guides maintenance decisions to avert accidents and loss of life and properties.
Other committees that presented their budget defense reports include Committee on Agriculture, Industries, Solid Minerals, among others. As part of efforts to address insecurity and all the challenges facing communities across the country, the federal government has adopted a bottom-to-top approach that carries people along at the grassroots towards finding lasting solutions. To this end, a citizens' assembly has been convened by the Senior Special Assistant to the President on Community Engagement North Central Zone for stakeholders in Kwara South Senatorial District.
The Senior Special Assistant to the President on Community Engagement for the North Central Zone, Dr. Abiodun Esiet, noted that the essence of the meeting was to interact with the people on the critical challenges confronting communities in Kwara South Senatorial District and to proffer solutions through Mr. President. She advised the people in attendance to work in synergy with security agencies to nip the issues of kidnapping and banditry in the bud, assuring the gathering that all the challenges raised will be tabled before President Bola Ahmed Tinubu.
This is the first time that they are seeing a federal government present in their local communities, which is a plus to Mr. President's commitment in boosting community engagement. They will see more federal government presence at their local government level to listen to their concerns and document their concerns.
The Senior Special Assistant to the President also visited Ajashepu to meet with traditional rulers from Ifelodun local government area.
We are more than grateful that Mr. President knows that there are Nigerians at the grassroots.
The Community Engagement Initiative is expected to facilitate peace, security, and sustainable development in the country. Mutiat Olushola, NTA News.
The Executive Director CEO of the National Primary Healthcare Development Agency, Dr. Muyi Aino, has described the graduation of Cohort 1 and 2 of the National Health Fellows as a major milestone in strengthening frontline health care delivery in Nigeria. The National Health Fellows is an initiative of the President to inject fresh talent into the health sector. Dr. Muyi Aino, who spoke at the event in Maiduguri, said the cohorts have begun the process of strengthening primary health care services in the country.
We know that our citizens are now starting to rebuild trust in the primary health care system. And we know this once you look at the service utilization in the facilities. More Nigerians are going to health centers to receive services.
Almost a manifestation of a vision to develop the next generation of healthcare leaders in Nigeria.
The team thereafter paid a courtesy call on Governor Babagana Zulum, expressing appreciation to the Borno State government for its continued commitment to healthcare reform. The delegation also commissioned the upgraded Borno State Cold Store and the Zamari Primary Health Care Center in Gonduga local government area. The Joint Admission and Matriculation Board, JAM, has cancelled the registration of candidates soliciting fraudulent assistance ahead of the 2026 UTME. JAM Registrar Professor Ishaq Oloyede stated this at a press conference in Abuja. He revealed that most of those involved are underage and warned that the board is tracking and harvesting data of candidates seeking help.
It's artificial intelligence fraudster, and those who have applied, even if we cannot ban all those who have applied, all those who paid, knowing fully well that they signed the form and they knew what they were paying. All these people want to cancel their registration this year. One disturbing aspect that we have not looked at. Look at the high number of underage candidates. A large number of them now involved in soliciting assistance and paying their parents paying assistance.
He reaffirmed the board's zero tolerance for examination malpractice, stressing that those involved will be sanctioned. NTA's Director of News, Halima Musa, MNI, and pledged rather support for media organizations in promoting integrity in the process.
From applying for tertiary institutions, I saw the uproar, and that crowd was not comprising parents. It was registrars and chief executive officers of institutions, and they jumped and said no. And I wondered why. I think the media has done so much for JAM, and mainly it's because JAM also carries the media a lot. So I think we'll continue to work together. I can see that. And we try to continue to fight this battle together.
In a related development, JAM says it plans to dismiss 3 staff members accused of selling unauthorized access to its examination portal as it intensifies efforts to curb exam fraud ahead of the 2026 UTME. The Defense and Police Officers' Wives Association, DEPOA, has graduated Batch 18-2025 of its Skills Acquisition Program, empowering families of military and police personnel with vital skills for a brighter future. The program aims to support wives of fallen heroes and vulnerable youths to become self-reliant, boost the morale of personnel in the front line, and enhance national security.
In Nigeria's evolving security environment, discussions about national defense often center on strategy, firepower, and operational readiness. Yet, beyond the front lines, lie another indispensable source of strength, the home front. Shifting the narrative and amplifying the voice of the home front formed the core of this gathering. Over the past 6 months, the Defense and Police Officers' Wives Association, DEPOA, has trained 130 family members of military and police personnel in a range of vocational skills. The ceremony, organized by the president of DEPOA, Menon Femi Oluyede, was more than a celebration of completed training, but represents a deliberate investment in the stability, resilience, and economic empowerment of military and police families.
By equipping participants with practical market-relevant skills, The program promotes economic self-reliance.
The men in the front to face deaths and to keep pressing forward. You know, it's a whole giving your life for a country. So I think that this, in some little way, makes up for that by showing them that, yes, we care about what is happening with their families, especially in their absence.
That's one thing with the poor. There is consistency. When someone step out, the other person just quickly step in. So I want to commend my sister.
With the help of the starter pack, we'll be able to do our thing in our comfort space.
At a time when Nigeria is confronting complex security challenges, welfare-driven initiatives serve as quite a powerful contribution to operational strengthening and reinforcing the foundation upon which national security stands.
President Bola Ahmed Tinubu has reappointed Dr. Ahmed Abubakar Audi as the Commandant General of the Nigeria Security and Civil Defense Corps for a new 5-year term with effect from Friday, February 27. Dr. Audi was first appointed to the position in 2021 by former President Muhammadu Buhari. His initial 5-year term ended last Friday as he participated in activities commemorating the 2026 World Civil Defense Day in Abuja. He will resume his duties on Monday with a renewed mandate. All right, we'll take a break, but when we return, we'll be discussing Lassa fever. We're going to count the cost. Thank you for staying with us. Nigeria is once again grappling with a surge in Lassa fever, a viral hemorrhagic disease transmitted primarily through contact with food or household items contaminated by urine or feces of infected mastomys rats. In this report, Oluseyi Adiagbo examines the latest statistics and trends on Lassa fever infection.
The Nigerian Center for Disease Control and Prevention reports that 318 confirmed cases have emerged from 1,469 suspected cases, with 70 deaths recorded so far, a troubling spike in fatalities that underscores the severity of the outbreak. 5 states of Edo, Ondo, Taraba, Bauchi, and Plateau account for 91% of confirmed infections nationwide, making them the epicenters of the current wave.
Going through our statistics, if you compare where we are now as against where we were last year, we are doing better in totality in number of cases, but the only worrisome is that more people are dying. We need to know why, especially healthcare workers. Health workers, everybody again must adopt this infection prevention and control, which is what we see is lacking, both at the state's facilities and even in the community. But one key thing we found, like all these outbreaks emanate from the communities, local government and state government. And that's why in our current address here now to build sub-national capacity. If the states themselves cannot take control of this, there's very limited what NCDC can do, especially with respect to our limited resources.
The NCDC is intensifying surveillance, case management, contact tracing, and risk communication as the country counts the cost of lives and livelihoods. The message from the public health officials is clear. Vigilance, hygiene, early reporting of symptoms, and collective responsibility remain Nigeria's strongest weapons in confronting the Lassa fever crisis. In Abuja, Oluseyi Adiagbo, NTA News.
Ondo State, one of the states with the highest number of confirmed Lassa fever cases in Nigeria, has continued to strengthen its disease surveillance system. In this report, Abiola Rio examines the treatment burden and case management efforts in the state.
Ondo State remains at the forefront of Nigeria's fight against Lassa fever, hosting one of the country's foremost treatment centers, the Federal Medical Center, alongside the State Reference Hospital in Igbatoru, Akure. The state continues to bear a significant treatment burden, receiving patients from within and outside its borders, especially during peak outbreak periods.
Because we have ensured that all preventive measures, IPC measures, is observed.
The isolation wards of the State Reference Hospital Akure, healthcare workers operate round the clock, managing both confirmed and suspected cases.
Our mortality rate has dropped. Many years ago, it used to be in the 30s. Last year, it came as low as 11%. So we are trying to reduce the mortality, but people still die. And most of those who die is because by the time we get them finally into the treatment center, they are too far gone.
The antiviral drug ribavirin remains central to case management, as medical professionals say the medication is readily available at designated treatment centers and is provided free of charge. In Akure, Abiola Rio, NTA News.
All right, we have a guest in the studio who will speak to the issue. Let's welcome Dr. Yetunde Abioye. She is the National Incident Manager for Lassa Fever and lead of the One Health Coordination Unit at the Nigerian Center for Disease Control and Prevention. Thank you for joining us, Dr. Abioye.
Thank you for having me.
So I'd like to begin with Benue, which we got reports from the Health Commissioner there, 45 confirmed cases out of 250 suspected cases, 10 deaths recorded. What is worrisome is the health personnel who are more involved. What is the center, or rather what has the center gathered in terms of surveillance?
All right, thank you. I bring you warm greetings from the DG of NCDC, and we also appreciate the continued partnership of the NTA in ensuring that we prevent and control priority diseases like Lassa fever. So we've been collaborating across the 36 states and the FCT to ensure that we provide timely strategies, and we've had off-site and on-site support where we even deployed National Rapid Response Team to go to 7 states, which Benue was one of these states, and we provided, we went with our experts across surveillance, case management, IPC, risk communication to support the states on the strategies, and we were able to establish some certain structures. In addition to that, I know Benue is one of those states where we have a high number of healthcare worker infection, unfortunately, especially during this period. But then we are also collaborating with them to provide every necessary thing that we can to support the ongoing response, and even provide further assessments that will be done in the course of the week, hopefully. So for us, healthcare workers at the forefront of this fight, of this ongoing outbreak, are very critical, are very important. We know what it takes to train a healthcare worker, and we understand how painful it is to lose a healthcare worker who is still in the country despite the challenges. But we are doing all we can to see how we can collaborate with them, raise their index of suspicion, provide the necessary PPEs and everything that they need to manage these cases promptly.
So, Dr. Abioye, Lassa fever is not new in Nigeria. It's a seasonal thing. And every year we get to see this happen. What is the state of the response system in the country? Would you say it's proactive or reactive?
So it's more of proactive, because the reason why I would say that is that when we de-escalated the National Emergency Operations Center in June last year, on the 11th of June, we were in alert mode. So alert mode is that we didn't go back to sitting down on our oars. We came up with strategies to see how we can continuously see how we can collaborate, because we know it's an endemic disease in Nigeria. Cases are reported all year round, sometimes an average of 2 or 3, especially in off-peak seasons. But unfortunately, we know that cases are reported all year round, especially in endemic areas. So we didn't rest. We evaluated what we have done and how we can improve. We continuously had our meetings once in every 2 weeks. We continuously produced our situation reports. We also continuously provided support to states, timely, providing test kits across our network, ribavirin for treatment, and also try to see how we can support states in their after-action review, that's reviewing the outbreak, which we did. We provided off-site and even on-site support in collaboration with our partners. And following this, we also did a dynamic risk assessment in December, looking at the risk calendar, which we also updated, because we now know that we have a narrower window looking at climate change and all of that, where we might say as a season or time for recovery, but we know that we barely do not have, which is July, August, and September. Outside that, every other period we are on response or about to go into response on alert mode. So we are very proactive as since the technical working group was established in 2017, collaborating, coordinating with the state to see how we can protect the health of Nigerians, knowing fully well that these outbreaks begin and ends in communities.
And talking about these communities, we hear the challenge of poor awareness, or people don't present these cases because sometimes they don't even understand the symptoms. So talk us through it.
Yes. So unfortunately, we know that most times people self-medicate, and when they present in these healthcare facilities, it's already too late. The last thing on their mind is to go to a hospital for diagnosis. But we want to let Nigerians know that Lassa fever is not a death sentence. It is treatable, it is preventable, and can be controlled and managed. But then timely diagnosis is very key. So when you are treating for malaria, and more than 48 hours, that's more than 2 days, or even if you suspect you have a fever, maybe you are taking an antibiotic for more than 2 days, and it's not resolving, you're not getting results already, it should raise a very high suspicion for Lassa fever. And I won't restrict this to just endemic areas, because in the whole 36 states and FCT, we are a highly mobile and very active population. People move around. Yes, in endemic areas it might be more, but anywhere across Nigeria, we know that people can come down with disease with the movements that we have, you know. So it's very important that when you are treating yourself for a fever, like maybe from malaria or any antibacterial infection, and it has not resolved within 48 hours, you should raise your index of suspicion. Some of the signs of Lassa fever mimic many different types of illnesses like malaria. So you can have things like fever, general body weakness, you could have, sore throats, headaches, persistent headache, you could have vomiting, diarrhea. In late stages, unfortunately, you then have bleeding from different orifices, whether from the eyes, the ears, the nose, the mouth, vagina, anus. That's in late stages. So we don't really want it to get to that particular point. That's why we always advise, do not self-medicate. But then in case where you are taking an anti-malaria or an antibiotic, and it's more than 2 days already, and you are not getting any symptom, you should raise a high index of suspicion for Lassa fever, especially within this high transmission season of Lassa fever, which is from January to May.
Okay, thank you, Dr. Abioye. We'll pick up with the conversation. We have to take a break. You stay tuned. Thank you for staying tuned. The number of Lassa fever cases in Edo State this year, medical experts say, is low compared to the past years. But Udwa Ubang Achabang reports.
Irwa Specialist Teaching Hospital, the hospital being the center for Lassa fever diagnosis, case management, surveillance and research, has been on its toes to curtail the incidents in the state, unlike other years, as surveillance officers are always on ground to do the needful anytime the need arises.
There are many L that lead to mortality from Lassa fever. Late presentation, late collection of sample, late initiation of supportive care, and low financial resources.
Some patients who were successfully treated from the Lassa fever disease narrated their ordeal.
I treated for malaria and typhoid, verbal treatment, and to no avail.
He say head and body they hot, her eye, everything just red.
The director, Institute of Lassa Fever, Dr. Joseph Okwegwale, and a community doctor said the case of Lassa fever, which is common during dry season with high mortality rates, is prevalent in the rural areas than in the urban areas in Edo State due to bush burning, drying of grains outside, low hygiene, and late presentation of cases.
In 2024, they reported about 70% of case fatality from the disease. In 2025, I think they reported up to 18.4%. More people died in 2025. So there's no year you don't have a couple of people dying. And why do people die from this disease? Oftentimes, it's late presentation.
And you know that you may not be able to see the breast on east and west and Edo North, Aruchi and Jatu area. We have more cases of Lassa fever.
They advise that people should cultivate the habit of cleanliness, cover their consumables, and try to eradicate rodents from their homes to curb the contact of the disease. In Irua, Sylvester Imon Kwede, NTA News.
All right, Dr. Abioye, we saw the progress recorded in Edo State, which I'm sure other states were hoping will be replicated. But the question is the response commodities, that's the personal protective equipment, the drugs and all of that. Is Nigeria having enough support, especially from partners? You talked about that earlier, but these commodities are very important, which is a challenge, especially when the pressures are much in these hospitals.
Yes, thank you so much for that question. So it's very, very important, like we always tell our healthcare workers, to maintain a high index of suspicion and also to practice, regular hand hygiene and standard IPC at all times, right? Regardless of whether it is a Lassa fever season or not. Speaking now about the state commodities or the level of commodities that we have at the NCDC, we usually do a quantification exercise to be able to prepare for the imminent outbreak. But then we also know that states also have a responsibility to also support the treatment centers that are also in these states. And with the Basic Health Care Provision Fund, some states have been able to do this for this current outbreak, even bolster the surveillance, sending out their states, DSNOs or state epidemiologists or rapid response teams to go out and look for cases and also trace contacts of positive cases. But we know that more needs to be done. Yeah. Funding is never enough. The Basic Healthcare Fund is there, but then, it's also not, it's a model that shows that it's possible if states can put down money, set up a budget line to support prevention and control of diseases like Lassa fever, then the outbreak will also be better. We do as much as we can at the national level to support the states, but then also this requires collective responsibilities. We cannot, as Nigerians, also continue to depend on partners. We also have to take responsibilities, and individuals as well have to take responsibilities, because we know that prevention is better than cure.
And you just picked the right word. Prevention is better than cure. Take us through those practical steps people should do. We still see people spread foods, by the roadside and all. People will eat bush rats, So what should people do, really? As a reminder, even if they know.
All right, thank you so much for that. So I believe that when people have adequate information, they'll be able to take informed decisions. And people have their rights as humans. We are social people. If you say don't do this, why? And what alternative are you providing for that? Yeah. So please, prevention is better than cure. We know this is a high transmission season. Like we always say, you have to ensure that your environment, not just because it's Lassa fever, at all times we should practice, good personal hygiene. I mean, growing up, I remember vividly we used to have monthly sanitations, but I don't recall if this, is regular anymore. So these are some of the things as well that we need to do within our homes, but then also in community. So it's going to take an approach that requires all of us to take responsibility for our personal health, community health, and also the health of Nigerians and other residents who are in Nigeria. So please make sure you protect yourself by ensuring you have, good personal hygiene. In the community, come together and do some community cleaning. I know some NGOs are doing this, but then the LGAs as well, the environmental health officers, are also there to support and guide. Please institute this. We also advise that you cover your food properly. We also advise that you shouldn't dry food by the roadside. If you're going to have to dry this food, use a raised platform to dry them, and also have a certain time. Don't leave this too early or do it in the time that you know that the sun will be able to dry these foods, and not leave them out there overnight. Do not also leave your food uncovered. Cook your food properly. And for those as well that also have, a certain delicacy that they eat that might procure them, make them vulnerable to Lassa fever, we also say at this very time especially, please apply caution, because we know that the rats, because of the dry season, are currently looking for food. And any food that is left unkept, uncovered, they will have access to this. And whether through their urine, feces, their fecal droppings of their feces, right, or people consuming this, it could also predispose them highly with a high chance to Lassa fever. So it's our collective responsibility to do this. Please take responsibility, protect yourself and your family members. We want you to stay alive.
All right.
Thank you.
Thank you, Dr. Yetunde Abioye. I feel your passion and the passion these rats carry. Some of them are very stubborn, no matter what you do, but prevention will always be better than cure. Thank you so much for coming on Weekend File.
Thank you for having me, and I also send warm regards from my DG, Dr. Olajide Idris. We hope we'll have more of these sessions as well.
All right. We'll leave the conversation there, Dr. Abioye. So let's pause for some messages. We'll be back.